Good morning, everyone. Glad to have you all with us. So my name is Leila. I'm humanitarian child protection specialist, and I will be one of your speakers today. So what we're hoping to cover in this hour and a half, as you can see, so we'll be talking about specifically remote child protection services, remote child protection and education services, actually. And we're going to start looking at what are some questions, what are some things we have to think about before choosing what services to use. So whether we're going remote, whether we are not going remote, and it's from a child protection perspective, but also from an IT perspective. So we'll have colleagues from IT services joining us. Then looking at some other considerations when we are delivering remote services. What do we need to think about when we are doing that? And then we'll have 4 field officers that are with us now and who'll also do some presentations, both on some of the tips of some of the things that they've already put in place and that is working, and some challenges. So we'll have Albania, Nigeria, Jordan, Lebanon, and India presenting with us today. So for that, we've got as speakers myself, Maria Bre, who's Global Child Protection and MHPSS Advisor. Hello, Maria. Lourdes Carrasco, who's Technical Advisor on Case Management. Jesus Fernandez, Head of Information Systems and Analysis. And Eric Monnier, who's Head of Information Services. So you've got a big group of people on child protection, IT, and information systems with you here today. So that's it for me for now, and I'll give the floor to Lourdes to continue.
Thank you. Hi, everyone. Good morning, good afternoon, everywhere. So yeah, as Leila explained, the first part would be going a little bit back before we discuss on remote services is when we decide if we go for remote services or not. So what are the operational considerations? Is it feasible or not? And we are going to see a few key questions that we need to ask to ourselves. So how do we choose the modality? Next, please. Face-to-face or remote, meaning that this has to be locally decided because it's very much contextual, but there are a few questions that we can ask ourselves before going or not into remote. Meaning what is the different topics and the risk and the level of transmission of the exposure of the virus. So this is very contextualized, and the different risks have to be, we have to find this balance between the risk of the child or family that we are following up or that we are newly identifying or that we have to provide services. When we talk about level of risk within case management might be easier to understand on the level of prioritization, but for any service, this is what we need to take into account. So farther than case management is also just trying to think about our priorities, and when it's a priority case is also when well-being, development, life is at jeopardy. So then it's about the risk of the child, the family, and the people we have to serve, but then what are the also urgent needs and tasks? It's not only about a case or a family or a child, but it's also some things that we might need to do that require or not personal interaction and being physically present. For instance, we need to accompany for a legal appointment. This might not be like higher risk, but it is an urgent task that requires our presence, maybe, depending on the context. So it's to think about it. And also the level of exposure, as we said, and the transmission of the virus in the area where we are working. So it's one part is the area where we're working and the level of transmission, but then another part is also the risk of us being vectors or us also the risks of receiving. So it's thinking about ourselves and staff on if we have risk factors or not, the staff and family, and all these questions need to be we need to think about all these questions together as a team also, and thinking about all this balance against the severity and our capacities to do face-to-face or remote. Next. And so for those who have seen also the case management guidance, and I'm not talking only about case management, but these are a few tools that we developed also, but you've seen this flowchart developed internally in TDH, and it's also being published at the interagency level. It's to help the decision-making process on if we go face-to-face or remote. I'm not going to in detail for all the questions, but just guiding through this flowchart, thinking, is there total confinement or not? And knowing that we are now in deconfinement in a lot of places, that doesn't mean that this is not applicable. Because one question we ask ourselves if we are in total confinement or not, but then these questions might be always useful in this period of time that we are in, because the risks are still ongoing, even if we are in deconfinement. So first question would be to know if we are in this situation. But then a key question that we ask ourselves to go remote or not is, do we have the capacity to provide the services with safety measures, social distance, and prevention? Or do we have, do we have the capacity to provide protection equipment to our staff? And so these two main questions will also guide us in knowing if we can provide these on social distance, okay. If we can't, can we also have further protection? And if not, and then of course, as we said before, if what are the risks within our staff and in the area we work with. So those questions will lead us to a first step of yes for remote or no. So we have to go through remote or yes. And then we think about what are the essential tasks that will require our personal support. That means also that this flowchart and the decision-making is not about that for one specific case, family, child, we will go always remote or always face-to-face. It is a combination of both in most of the cases, actually, because we might provide remote services for a case or a child, family, but then there might be some actions that require personal support and interactions. So this is, again, we follow this flowchart to try to think together, but also thinking together with teams and frontline staff to see the level of feeling comfortable or not and the risks that we might have. And the understanding that both services, both at remote and face-to-face are highly, I mean, it is needed, both are needed. So we might need a combination, and it's how do we distribute also our work and caseload. And again, it's not only for case management, even if it's done, but this is helpful for any kind of service that we provide. Then there is this last part of questions. Are there any confirmed cases? So this might require more, but this is more for face-to-face. And if we can't really provide protection and we can't provide this face-to-face support when there are this level of risks, we go for remote, and then we need to decide and to go back to the flowchart. So this is just to help this decision-making, and of course, if there are any questions, we will have also more time for questions, but I won't go into detail of each one because we could have a full webinar actually for each question. But again, the main fact is to balance risks and the situation in context, and it is decided locally. Next. And to finalize this operational consideration is not only about the feasibility and the operational, but it's also about the ethical considerations on how we do remote. So we are in extraordinary circumstances, and normal practices do not apply all the time. So we need to think it through, and to maintain always the same ethical principles we do work usually. So some examples that we might ask ourselves is, when we go, so this is also the second step, we have decided, let's say that now we go to all the flowchart and we have decided that we require remote services. So then there are these ethical considerations on, are we increasing inequalities? So we need to take into account, might be easier to follow up on remote for those who have access, but what about where there is no access to technology or even phone? Or so we need to think about if we are reaching everyone and what are the barriers. Maintaining confidentiality. So we will see now in the next session also on the technology part, but also for other kind of remote services, might be challenging at some point, and we need to ask ourselves what is best to do. And this is again the balancing of the ethical case-by-case questions that we always have to ask ourselves is, if I can't ensure 100% confidentiality, what is best to do? I mean, it will depend on the risks, and is it more risky to do something or not to do? And we will see now also with the different modalities. And then maintaining clear and appropriate boundaries. So it's, again, as we said, is the same ethical principles we always have, but added considerations on remote services. So we know that if we go work from remote and sometimes from home, or so should I use my personal devices, or should I also provide services at any hours? We will see also more details after, but again, keeping boundaries, it is important. Of course, it will depend on case by case and balancing. It depends on if we are available for some emergency cases or not for these boundaries. But then also it's maintaining and establishing that even if it's remote, we continue doing the same work and with the same boundaries. And then it's trying to discuss all these questions at local context and adapting as the best we can do. So the ethical considerations have a lot to do on a case by case and on context related, but we see that we can have a lot of questions that guide us and our decision making. And now I pass the floor to Maria to see all these other details that we were seeing on the technology part.
Thank you, Lourdes. Yes, as we've just seen, I mean, once we have decided if remote can be actually appropriate, once we have taken into account some of these ethical considerations that you mentioned, we might start asking the question, okay, if I want to go with remote, which technology actually I have available, can I use? And are they safe? So some of the issues that needs to be assessed for that would be to assess the context, the communication landscape, the operational feasibility, and the confidentiality and data security. So looking at the context, of course, I mean, basic question like we would do for any kind of services, but who is the audience? Are there children, adults? Is it individual support or group support? We know that it's going to be very different. If we just want to have an individual discussion, phone can be possible. If it's a group interactive session that you want to try to do, you can have some phone conferencing, but this can be challenging, or you can, if it's available, go for some more complex and sophisticated platform on internet. Asking if the audience is literate, if the audience is also digitally literate. If we imagine that we're going to ask them, for example, to plug in, to download a specific app or a specific system, do we think that they're going to be able to manage? Availability of digital internet facility and connectivity, of course. And this comes to mind straightly, but also when we assess the context, as we've seen, even if we go for remote, there can be some situation when we think that face-to-face will be still essential. So it's important also to look at the availability of confidential and safe home premises. Is this actually possible to visit some people and have a confidential and safe interaction? And of course, looking at what is your objective. And I think that this is something that came up already in the discussion with the decision tree, but it's coming back on your objective will also tell you a little bit more about the type of technology that is needed. Next slide, please. So the second element is to assess then the communication landscape. So looking at actually, and we'll go through that a little bit more in detail with Jesus and Eric, but what are the modes of communication we have available and that we are also promoting as safe and so on? What are the modes of communication and sources that the audience, the people we work with, actually rely on? What are they used to already use? Do actually people have access to mobile phone or other communication hardware? We also know that sometimes in some context, there might be only one phone for a whole family. So being very clear of considering what does it mean in terms of relying on this one phone, for example, discussing with a child or other. Can people actually afford to use mobile phone? And this is something that I think that has been already considered by a lot of delegation, but having a plan in terms of planning the costs and including some money for supporting people with actually have some I would say credit available. Do the people have access to source of power to keep the device charges? And is there connectivity in the target area, or can it be restored? We have seen that this is all, it's a big challenge, for example, in Bangladesh, where whether internet or even phone connection was really a big challenge, and that here it also tells us what needs to be done. If really no face-to-face visit is possible, then it's really to go into advocacy of making this as an important case. I will give now the floor to Eric.
Yes. Good morning, everyone. So from the, I will speak here about the technology. So we have made a lot of tests with many different tools regarding the communication and collaboration needs within the TDH collaborators. We retained 3 main tools that are the corporate one, because they are already installed in most of our countries, in most of our regions. It is Microsoft Teams, Skype for Business, and Outlook for emails. Regarding video conferencing, chatting, voice conference, capacity to record, and many of other functionality like we do today in Zoom, for example, we have these corporate teams. They are all, the 3 tools are all available for all TDH staff now, because we have fully, more or less, deploy Windows 10 with our corporate laptop and environment of Windows within all countries. And this allows communication now with all internal collaborators, but also with these tools. With these tools, we can organize events or meetings with externals, with partners, even if they don't have any Microsoft account. Microsoft Teams is definitely a recommended solution. I said recommended at this stage only, and available for all type of device. It's available on the phones, on the tablets, on the iPhone, on the Androids, and of course on the computers. Skype for Business, just to be known, will be end of support in July 2021. So we will be able to use Skype for Business anymore for only a bit more than 1 year. Concerning the assessing of confidentiality and data security. So all these 3 platforms are hosted internally on our private cloud. This private cloud is fully secured and encrypted for the others, from the external. So they are hosted there, and it's for us a secured environment. Concerning the performance and issue you could have in different countries, then there we have some verification that still need to be made, of course, but from what we know, in many countries, Teams, if you have too many performance issues, are sufficient to exchange, to collaborate, and to change. Of course, the courier will have to validate our official positions in the next weeks or months, but currently from the IT, definitely Microsoft Teams is a recommended one. Even if for next slide, please. Even if for technical reason we have done a full comparison with different other products like Skype, normal Skype, that all your beneficiaries or external or partners are using, Skype, Signal, WhatsApp, or the Zoom that we are currently using. So Signal is more or less the same than WhatsApp, but with better security. And you can see there a list of functionality. I will not go in details. I don't have time, but I will let you check that in a future reading. I can imagine that these slides will be communicated to you. So I have finished there and will be available, of course, for technical or question and answer. This one is for Jesus. Is Jesus there?
Yeah, thank you, Eric. You just received, thanks to Eric, a presentation, a comparison of the several tools that are available, the corporate ones and the other ones. Technology is not the only challenge that you are faced. Before, Maria explained to us that beneficiaries might not be used to new tools. So we totally understand that even if we provide teams to each one of you, it might be difficult for some beneficiaries on the ground to use that tool. The only recommendation that we made is that if you really need to choose other tools, please be aware to delete the data afterwards and to ask our beneficiaries to delete the data, because we cannot control that information and how afterwards it would be shared. There is no way for us to control the data, but on our personal infrastructure, we can at least avoid it is being forwarded. Another question is about how to record the informed consent. We are looking for the possibility to record per video or just the sound the informed consent of the beneficiary. We are not sure that it is the best solution. Why? Because if you record the beneficiary saying that he agrees, you need to tell him that you are going to record that. And just the fact of letting him know that he's being recorded might change the type of relation that you will have with him or with her. So at this moment, on an ethical point of view, just documenting the oral consent is okay for us. And the third point, we understand that the delegation cannot provide a personal smartphone for each one of you. We are looking if we can do something, but it seems a little bit complicated for us here at the headquarters, because we cannot handle the services linked to the networks. So please, if you are using your personal smartphone, again, delete the data. These were the 3 main points for me. Thanks a lot.
Thank you very much. So we are just at the end of the first part, and we really want to give every one of you the opportunity to ask any questions regarding what has been shared up to now. So the choice of going remote versus face-to-face, and the choice of the technology. So if you have questions, please place them in the chat box, and I will read them that our presenters can answer. So first question is, how do you delete data as suggested previously? So Jesus, you mentioned that when it's not from...
Yes, thank you. So it depends from the tool that you are using. I presume that most of the case will be data exchange via WhatsApp. We are only talking about communication, not about file sharing. So from my point of view, and I will give the opportunity afterwards to Eric to confirm, just deleting the conversation is sufficient But be careful that the contact is still, if you save the contact will not be deleted. At this stage, we do not have any recommendation on how to handle your contacts. Eric?
Well, this is really depending on the tools. For Skype, it's quite easy to cancel all the conversation. For Teams, you can remove it as well directly from the client. And for the others, well, WhatsApp and Signal, that's due to directly individuals. So with Signal, for example, you have an option to have ephemeral exchange. So you can activate it before the conversation and then define for how long you want to keep this conversation, and then it's erased automatically afterward. So that's all regarding the recording. When you do a recording within Skype for Business or for Microsoft Teams, this is going directly within our private cloud and is directly managed by us. For the others, nobody really knows. With Zoom, it could be on a private computer, it could be somewhere on the cloud, depending on the choice you made on configuring it.
Thank you.
I can also add an example on deleting, just from a field example, and you can also feel free, anyone, to add comments beside questions or examples. But on deleting data, for example, on sensitive cases, where Maria was explaining also that sometimes the family might have only one phone. So this is it is not on how to, but it's an example on when to. And we might have a conversation on WhatsApp or phone because we can't have any other option. So it's what field teams have done in certain cases, knowing that there were sensitive cases, use SGVV or asking both the person we are talking to and ourselves to delete the phone call and the messages or the conversation we've had. So we are sure that within the household, nobody else has knows or has access to what we discussed, or that even there was a call actually.
Thank you. We have another question, and maybe we have time for this last question. Would you recommend keeping records of data that are deleted from apps, for example, copy pasting into a Word doc that can be password protected? Yes, Jesus.
Thank you. This seems a good option, but be careful. Then the question is, where is going to be that that Word doc saved? Where is going to be the storage? So it's only half of the solution. We are not now working on a recommendation on where and how to store sensitive data, and it would be the second part of the story. So I would say that first, encrypting and saving your password, a different password for each application on the side is really an excellent point. But afterwards, you need to know where to save that sensitive information. And we are going to come with a recommendation on how to structure the storage.
Thank you.
And if I can add just a final point on what the examples that we said, it's just to make the point that what Eric and Jesus explained. From a field perspective, I agree that sometimes we are a bit reluctant to new tools, but looking at the table is quite useful because we see things that we didn't know actually that are possible. So it is quite interesting. And just to say that I explained an example using WhatsApp or phone, which is not the corporate one or the recommended, and just to strengthen the point that it depends on the objective, and that when we talk about data within the apps, or so that it's not one thing is to have a chat or a conversation, and the other one is storing data, which is not what is recommended through any non-corporate tool, as they were explaining. But I think it's useful to take a look to the table that they shared also.
We have just the last question coming. If we can maybe just take 2 minutes to answer this question, it's interesting. When we propose a remote service, we are responsible to inform the beneficiary about the data management protection. how do we make it to be clear and accessible to a non-IT, but also comprehensive? Our colleagues from the field do need any guidance on this.
You want an IT guy speaking non-IT? I think that the information is not related to the tools, but to the fact that we are able in certain cases to keep some information. I don't think that you have to go within an IT perspective. Just need to understand that they will just have to keep the information. I don't think there is specific, Dorina. I don't know if you have specific other more details regarding your question, because here it's not an IT answer. I cannot give an IT answer. Jesus?
Yes, this idea does not come from me, but it talks to me. I was in copy about in an email exchange saying that what could be done is a two-step approach. That in the first step, you explain you explain the beneficiary that he needs to give his consent. So you are just explaining things, and you are not pushing. You are not hurrying for him to give the consent. And so afterwards, you let him time to think. And in another meeting, you say, okay, did you think about what we said? Do we have your informed consent? And this is really important from a GDPR point of view, because first, he really has time to not to give is okay. And he does not feel the pressure. So this option is a very interesting for me. I do not know if most of you already heard about that. Like I said, I just received that option yesterday, and it suits the GDPR needs at least. For the first meeting, it's obvious that you cannot read all the documents that we usually make them sign. But anyway, everybody is very conscious that informed consent might significate different things from the perspective of the one who's thinking about it.
Thank you very much.
It is indeed quite an important point, because everyone has always the choice to say no. So it is a very important point that we change modality, and everyone needs to be on the same page. But it is a very important point, and I think Leila will also provide some information on that after.
Just because of time constraints, we need to go on. I see we still have some questions in the chat box, but we will try at the end to answer most of them, or then we will continue exchange through emails. So we will go to our next part, key consideration when delivering remote CP services. Leila, I see you are ready.
Yes, thanks, Ruth. So I'm also going to bounce back on a couple of points we've just been discussing. So now it's saying, okay, we've decided to go on remote services. What are the things we need to think about? What are the things we need to put in place? And what are the things we need to discuss with our beneficiaries, with the people we are phoning or having a remote contact with? So next slide, please, Ruth. So some things before you start the service, it's important to not just go directly and saying, okay, here's a phone, let's go and do it. It's important to take some time with your teams to think about what are the things you need to put in place before you go and do it. One thing is key is to update your information on available services. So it's basically a service mapping, but I didn't put that word because when we talk about service mapping, it can be like days or weeks of work to have something comprehensive. Probably if you're already doing case management, for example, you already have your network, you have your referral pathways. But given this context, services would have most likely changed, being it government services, hospitals, other NGOs. So the services available have probably changed, and maybe their modality has also changed. So it's really important that you update that, and that you know what are the services and even the people and even community-based services that are available around the child and the family. Then it's important to have a safety protocol. Again, it's a big word, but it's just knowing on what will you do in which case. So for example, and we'll talk a bit later also on how to deal with conversations on the phone, but what happens if a child is unwell, whether it's a health or psychological issue where he needs, I don't know, he's crying or needs additional support, and also take into account your access. So if you are in a setup where you can do remote, but you can also do face-to-face, that's one option. So you know if there's a really high-risk case, you can still go and see the child, for example, or the person or the parent. If not, it's important to know what you'll do. And also have support for your staff. So if your caseworker has a really difficult case, how can he do? Like, can he phone you? Do you have a supervisor who's there present that he can call on to have support? And have really clear referral pathways. So for the caseworker, I'm taking case management as an example, but it works for whatever other support you are given. And know where to refer, if you can refer, and also know if there are no services or if you're on a total lockdown and no one can move. That's also important to know before you start your call, so you know what is the context you're working in. Then also think about child safeguarding, as we usually do. Nothing changes here, but think about it because your setup has changed, and do no harm. So it's linking to the service you will provide, but also the way you'll provide it. So it's going back to the flowchart Lourdes presented, looking at how you're making your decisions and making sure that whatever modality you're bringing to the family, to the person, to the child, does not harm them further. And it's also risk-benefit thinking. And then also think about your staff, the social workers, if it's TDH, or maybe also if we're supporting government social workers, they are probably not used to doing this. So we need to think about what support they need. So there's the phone, there's the credit, there's like the practical modalities, there's which IT support we're using, but also maybe checking that they are ready in terms of communication, that they're comfortable with it. I don't know, for example, some people don't like speaking on the phone. So also checking that they're okay with that, and maybe giving them some tips, reminding code of conduct and things like that. So it doesn't have to be something big or lengthy, but just checking that, you know, maybe having half an hour, training or briefing with them to make sure that they are ready for that. Next slide, please. So on child safeguarding, just some thinking. So as I said, nothing changes. So the principles that we usually apply even more. And we know in humanitarian settings, this can be even more fluid. I think here, at least we don't have a bigger turnover of staff, but that can also be something important to consider. So it's maybe just important, because the setup changes, to just remind the principles, remind the code of conduct, and remind them how this applies to having remote services. And then just think of what are the risks linked to remote services. If we were not doing that before, it's probably not in your risk assessments, it's not in your action plans. So what makes this setup different, and what are the risks that are linked to that? So as we said before, Eric said, and Jesus, that it's ideal to use work phones. Indeed, it's a cost, and we probably don't have that in our budgets. So one alternative, for example, is to use a SIM card. So at least your number is not your personal number, but it's a number, an official number, even if you're working with your phone. There's still data protection issues there, but at least you also limit, we're talking also about boundaries, it also helps you to limit that contact. Then it's also thinking of where you make the call, both for the social worker, the psychologist, the person who's providing the service, providing the support, and from the receiving end. So ideally, as we do with counseling or case management or anything that is one-to-one, is making sure you don't either put yourself at risk or you don't put the child at risk. And you want to avoid things like conversations that can be abusive, or also all the risks linked to online safety for the children. So for example, if you do have access to the office, it's best for the caseworker to do the calls from the office, for example. If not, but then they also need confidentiality. Other thing that you can do is strengthen supervision. So it's making sure that the person who's providing the service has regular supervision. The supervisor calls them, asks them how the conversation went, if there were any challenges, and just getting a bit of that sense and that support. And making sure that, so with new cases, it's a little bit more complicated. There's all the identification issue, but there's also systems with committee members that are in place that might refer cases to you or people. Make sure that those new cases are attributed to trusted and experienced staff. Also because creating the link with the child, the rapport is much more difficult by phone if you haven't had any face-to-face. And it's also a safety concern. Then also there's a lot of risks, and that's for any type of online access. There's a lot of online safety risks for children. So if we are promoting online devices, make sure that the children and the parents are aware of that. And then all your usual reporting systems, if you have a helpline or you have a TDH green number, making sure that they're aware of it, because again, your usual communication is not the same. And for example, you can have your supervisor doing spot checks, maybe calling up the family, checking that they're happy with the service, if there's any issue, reminding on numbers. Next slide, please. So I'm going to go quickly on this one because we already talked about it. It's informed consent, but this is really making sure that the person knows what the service is going to be and what it looks like. So it's maybe agreeing with them on when you call, how long you call for, what happens when the phone line or the technology breaks down, who do you try to talk about, who do you try to call again. Making sure we talked about professional boundaries. So again, for example, if you're using WhatsApp, it's really easy to blur those lines. So making sure that you keep that boundaries. It doesn't have to be the same as what you were doing before, but those need to be clear and you need to respect them. And then have emergency contact. So it's, for example, having the phone number of a trusted neighbor or a trusted other family member, so you've got an option. Next slide, please. And then, so we said call for a private room, and then also try and understand what is the setup of the person you're calling. So are they with 5 family members around them and the conversation is really complicated? Or do they have a clear, a calm area? So try and ask of, where they are, how do they feel, if they're okay to talk, and then also agree if they set up changes, how will they let you know that they're no longer comfortable to talk? So for example, one thing is to agree on a specific word that the child can choose, for example, and say, okay, when they use that word, it means they're no longer comfortable in talking to you, and you know that their setup has changed, and maybe you'll call later or find another moment to talk. That's it for me, and I'll pass the floor to Maria to continue on this one.
Yes, thank you, Leila. So we've got just a few slides here where we wanted to emphasize a little bit on one of the soft skills, actually, that is also something we really need to keep in mind in terms of delivering remote services, is about communication. And obviously, I mean, there are differences between communicating online and communicating face-to-face, and this needs to be acknowledged. And some of the challenges are, for example, around identifying and recognizing some emotion, or also about conveying some empathy and conveying support. And that's why actually we really need to have, I mean, I think that a lot of the advice and recommendation I will give you now are probably things you already know. But I would say that they are even more important to keep in mind and to help you prepare and structure your remote support because of the shorter time that you also have for communication. We haven't spoke about that so much, but it's true that one thing that is important is to acknowledge the fact that no, it's not the same of having a remote support discussion than a face-to-face one, and that you need to clarify the timing for which you will be able to have the attention of the person, the availability of the person, and that is often shorter. And so that you need to be very, I would say in a way, communication-wise efficient in this shorter time. And so all these things are things you need to keep in mind. So for example, the fact that you need to try to, as much as possible, to continue to express warmth, genuineness, and empathy, even though you can't actually also show these emotions. This can also be done remotely, keeping an attention, for example, on speaking slowly, clearly, calmly, also modulating the voice in a way that shows cares, can also communicate warmth. Ensure that you use open question, ask one question at a time, avoid interpretation, because we know that I mean, miscommunication and misunderstanding can happen much more actually in a situation of remote communication. And also, I mean, we'll give a few hints on that, but really using positive communication and listen skills. And also acknowledge also that the fact that, for example, there are some certain behavior or emotion like anger that might come up in even more strongly, I would say, when it's by phone, because it's less, I would say people might be less shy sometimes to be angry about something, and that also in this time of distress, we know that frustration and anger are very common reaction. One thing, of course, is to pay extra attention to non-visual cues. And actually, there are things that you can try, and actually that sometimes are also non-verbal. For example, pauses, hiccups, shortness of breath can indicate someone is crying. If someone is raising the tone of the voice or stop talking, this can show angriness. You can also notice some things like people forgetting the question, not being focused, being distracted, giving wrong or inconsistent answers. All these can indicate different things, whether the person is not following, understanding the question and the call, whether they are bored and they're getting tired. And so these are signs that you should really be aware of in order to adapt your communication. And by the way, here, just a little thing on the boredom, and if you ever have to do some calls with children and so on, when preparing this webinar, we came across also some great ideas of little games that can be done on the phone with children individually in order sometimes to regain a bit of the attention, if this can be done. One thing that is important also, and we've discussed with some of you already on that, is the challenge to build trust and rapport when you have a new person, for example, that you're going to support remotely. And I think that for that, there are also some hints about how you can structure the first discussion. I would say what is really important is to take time to explain who you are, how do you come across these cases. It can be referral, it can be the person that contacted you, but to explain your role, which organization you are from, show understanding, empathy, and confirm the needs. If you already know about some of the needs, confirm the need with the person, and clarify what is actually your role in supporting this difficulty. Explain also the fact that normally this discussion should have happened face to face, but because of the situation, you actually can't, it limits movement and you can't meet this person. And this is why after that it's important to have, I mean, the different aspect that Leila just talked about having this in mind, all the safety protocol, the confidentiality, the consent aspect that needs to be integrated then into this first discussion, even though you're not maybe pressurizing to have a discussion straightly, but giving this option, then clarifying everything and saying, okay, so I'd like to know if you would be interested for us to have a discussion so we can continue the remote support. One thing that also I just wanted to include here is the psychological first aid. I mean, most of you might know already this tool, and of course it's not something that is to be used only remotely, but again, because it's something that usually supports a structured communication, I really think it can be useful also in supporting remote communication. So next slide. So I will not go here in detail, but just this is the different phases of the PFA, where we have all the preparation phase, and we talked about that with the different aspect that, for example, Leila mentioned. Then there's this important step about engaging, and we'll come back on some of the techniques just in the next slide. The listening phase, which is very important in trying to calm and stabilize and bring and ensure safety, and being able to all what is said or not said actually on the call. And then the linking aspect, which is really looking at how you can link this person with existing network or with other services according to the needs. Next slide. So as we say, we really need to pay attention to minimize miscommunication, and that can be done by really checking regularly with the beneficiary. It can be through some of the active listening skills, like paraphrasing. This is well known by probably all of you, but I think it takes even more importance in the remote communication. It can be also through just making sure that you ask open question that can really help you identify the needs. Some of this question can be about asking how the family is able to manage the stress and the pressure of the situation. How do they deal with it? How are they doing? How do they feel safe? Also for clients or children or adults that you might be following previously, asking them about what has changed and how do they feel with that changes, can be an open question that can really help you identify the needs. One thing, maybe a little think about silence. We might feel even more sometimes uncomfortable about silence on the phone or using remote communication. I think it's important to keep in mind that silence is needed, especially when you notice, if you start noticing that there's something as a strong emotion coming out. It's important to give a time for this emotion to be diffused. And also, even though you stay silent when listening to the person, I think that keeping in mind of making the other understand that you are actually actively listening can be by saying, I understand, okay. That really makes sure that the person feels that you are here behind listening. There are other here tips that I can come back on if we need with the question, but I will go to the next slide. I just included here I've got 3 specific cases that we don't need to go through all in detail now. And again, you will have access to the slides, but some specific emotion that might make it difficult to manage remotely. So there's the sadness, there's the fear, and there's, for example, angriness and frustration. I think that for all of them, adopting a calm tone is really the first thing to do. As I said just now, I think giving space and time for the person to express the sadness or the fear. And after it's as we would do, I would say, face to face, but validating the feeling and understanding that the situation is difficult, expressing empathy. And also it can be proposing the person to stop the call, as you could do it maybe in some situation when you are face to face. If you see that there's a very strong emotion, is to discuss about what do we do? Do we stop? Do we do a break? How do you want to manage? These are important considerations. Next slide. So about fear, and this can be, you can feel that by different behaviors, someone that is hesitant to answer, or even that tells you that is scared to speak on the phone. Of course, as much as possible, it's important to understand the reason, to normalize and validate the feeling as usual. And you can again reassure the child or the adult that the call is not recorded, reiterate the concept of privacy, confidentiality, can also tell them that yourself, you are in a private room. This has already been said by Layla. And again, one thing that maybe is particularly important for us is that if we think that there is an important protection issue, that it's important to balance, do we think it's safe to get more information over the phone or not? And if we think that there is a risk of harm, maybe of urgent harm, maybe it's important not to go immediate, not to go further on questions, but to try to see immediately what can be done. And this comes back again on having the safety protocol in place, and look at who should be contacted in emergency, or is it inside your own organization. Next slide. So last, about the angriness and frustration, I think what is important here, again, as we would do it in a face-to-face situation, but it's really not to take it personally. If someone is very angry, saying that they have lost their job and that they don't think that you can do anything for them, and that they are very upset, it's important to validate the emotion and not to take it personally, and to say, I understand, and maybe I will not be able to help you get back your job now, but maybe we can go through some of the worries you might have, and we can see what can we do step by step. And I think that, yeah, again, listening, this is maybe the most challenging, is being very attentive to listen to all, even what would be non-verbal. And on a remote channel, this can be challenging, but I think that this is something that I wanted to emphasize on. And I'm done. Over to you, Ruth.
Okay, thank you, Maria. Thank you, Leila. Maybe when we have been preparing this discussion, we thought how much it was also important to get input from the field. So we invited some delegations to present shortly what remote services they have been implementing and what were some challenges they have been facing, giving us also some tips. So we will have first Albania sharing. So Blerta, if I may ask you to unmute yourself and
yes,
go on with the presentation. Thank you, Blerta.
Okay. So good morning, everyone. I hope almost everyone had coffee or tea, as it's gonna be a fast presentation about the adaptation of our operational programs and activities on the framework of the COVID. So, of course, lately we've been hearing a lot about the wash your hands and don't touch your eyes and your face. but what is the most activity that impacted not only the operations and activities, but also people's and children's life was the lockdown notification that was taken by the Prime Minister. Of course, it affected our internal response to case management. Ruth, if you can pass to the other slide, please. Okay. And it all started with an internal evaluation of most affected areas of programs and activities, but not only, also to the systems and to the preparedness of our capacities and staff to respond to this new modality of going from the face-to-face approaches to online response. Soon after, in collaboration with our M&E officer, but also the IT department, we were able to deliver a vulnerability baseline assessment and impact for COVID emergency situation to the most vulnerable communities, meaning to the beneficiaries of our activities and programs. In this assessment, we were able to capture not only how the lockdown and the COVID impacted health aspect of our beneficiaries, but also the implications it had to economical status, to domestic violence, child protection related issues. And also there was a specific component that we use this rapid assessment to assess the most used platforms that the community would be like to contact it upon. So there were practical questions about how, which of the online platforms they were most familiar with. If they were to be contacted by our field staff, how they would be contacted by phone, by social media, communicate through WhatsApp or whatever, their access to internet, and also if they wanted to get awareness raising messages, which channels they would prefer, if they would prefer television or radio or online communication. So based on this baseline assessment, we were able later on to adapt our activities, and in relation to our approaches on collaboration with other partners. So this is activities so far were only internal due to Terrorism response to that. But on a scale up approach, we also partnered with UNICEF and being part of the Child Protection Emergency Working Group led by UNICEF, along with World Vision and Save the Children, Terrorism contributed to the framing of case management to this new emerging situation of COVID-19. The decision of Council of Ministers, in a way, tried to put in a frame the new operational procedures about going online with case management in terms of provision of services, identification of cases, and managing cases of high risk. What is ongoing also is our capacity building efforts through Child Hub. We are targeting child professional welfare professionals, frontline workers mainly, on providing them some practical tools and working documents on how to shift the approaches online, how to be safe online, mental health support, and things like that. Something important that we are also working is also providing simplified working documents based on our internal operational documents, such as the Global Code of Conduct and the communication and advocacy documents for our field staff in order for them to have clear guidance about how to use safely the IT devices, how to select appropriate information to share with families and children, how to get the authorization for participation to activities online. This is something that is going on actually because in 2 months, emerging issues have been appearing, such as we have been approached by field staff more frequently, as it looks like Facebook is the most used platform by community members. So sometimes our field staff is approached through Messenger for getting services, which is something we don't really encourage. So in that case, we also do provide information to communities and to also our field staff about internal child safeguarding policy and regulations. and giving safe referral pathways information to community and to children that might be contacting our field staff. Ruth, next slide. Of course, we have been, in terms of remote case management, we have been continuing the online identification and assessment of cases through safe online platforms. We have a case manager that has a dedicated phone number by the organization. So every time there is a case identified by our field staff, the advice given is to share as much as possible this number so people and families can contact directly our case management officer. We have been continuing the follow-up of cases and provision of mental health support through online by communicating frequently by the most at-risk cases, children and families, in order to assess the level of impact that this lockdown situation had in their family relationship, but also in terms of child protection concerns. And of course, frequently we have updated our safe referral pathways about identification of possible and alternative support services that children and families can be referred to. Along with that, of course, as I previously mentioned, was the development of simplified guidelines and working documents for our field staff, but not only, also for our partners and community facilitators. And also what is going on is the supervision and mentoring on regards specifically to case management, as this is something that is new. The approach of providing of all these services on regards to case management online is a new practice. So our case management and the child protection safeguarding officer has been providing technical support to the field staff. While staying home and being safe, of course, there are some concerns that we are still facing. One is about the data protection, how much the data protection policy can and should not be a burden in child protection, about the level of, in terms of identification, about the level, how much information do we ask for and how do we keep record of that, considering that our staff is working remotely. And not all the times they have also access to adequate IT equipment. Some ethical considerations about being safe online. It looks like, of course, there is an increased communication of one-to-one from community members to our field staff, which is somehow out of the control of Terdezam at the national office. Of course, we encourage the institutional website or the institutional addresses and contacts of Terdezam, but this is something that continuously is going to disappearing. Coordination, it looks like at the field level, there is a lack of coordination. Child protection system seems like to be freezed because of this inability to meet or to exchange. At national level, there are several efforts, even from the Ministry of Health and Social Protection, but also from civil society actors. There is a child protection working group coordinated by UNICEF, but at local level, this kind of coordination is lacking. So everyone is doing the best they can. And the most important and the most challenging for us is the culture about child protection in general. What happens in home stays at home. Sometimes we take for granted that people and families have access to IT, to internet, and to information channels, but this is not the case always. So this is something that is like we are advocating a lot with the State Agency for Child Rights and Protection in order to actually go to what is hidden or what is not captured by us. So this is it. Thank you. I try to be on time as much as I can.
Thank you, Blerta. Yeah, that's true that we are running a little bit out of time. So let's go now with Nigeria and Blasius, if we may also ask you to be careful with time, but we really would like to hear also from your country.
Yes, good morning to everyone. I hope all of you are safe. Okay, so as you all know, TDH has been operating in Nigeria for some time now, and we have office in Nigeria. We have operations in other 6 locations here in the Northeast. So we actually do integrated programming covering WASH, health, child protection, and education in emergencies. So for the Northeast, we have issues around access, and we also have continuing insecurity issues with accessing field locations. So the COVID-19 actually entered in Nigeria in February, but by April of this year, we recorded the first cases in the Northeast. So there was a strict lockdown that started in April of this year. So because of the lockdown, we in TDH now, we're obliged now to adapt our services now to persons now to services that don't require large groupings. Next slide. Next slide, please. So the first major adaptations that we did concern our teaching and learning programs. So we moved from classroom-based teaching and learning, and we're going over now to radio-based learning. So it's like learning in small groups within the community supported by radio programs. Before we carry out the programs, there is some level of organization at the community level. So we split the community into cluster families. We say five cluster families. For example, we assign 1 volunteer. And these volunteers now mobilize, extract our learners from the cluster families and put them in smooths so they're able to access radio lessons, to follow assignments that are given based on the radio programs, and also to prepare them for the next lessons. So keep in mind that we operate in an environment where we deal with IDs and these IDs. So these learning programs, these teaching and programs have been, we've tried them, and we hope to see how that will progress. And this is done in order to keep the learners, we keep some level of minimum learning for the children in order to reduce the risk associated with school closures. So for these teaching and learning programs, there are some initial challenges that we are also registering. For example, the parents that we come in contact to, the volunteers, the parents are afraid that their children may be exposed when they come in contact with our volunteers, because usually they will come with all respective mask fit. And the second main challenge is that it's not good for supervising to verify if volunteer teachers observe all the full COVID protection rules as they go about in the activities. Then the other challenge that we had is that small is very labor. So
let's just
just area.
Okay.
Slide. Next slide, please.
Blasius, we have a struggle. We can't hear you anymore because of your connection,
we have been
maybe. Leila, could you maybe just
hello, can you hear me?
Yep, Blasius, we're losing you. I'll maybe continue if that's okay with you. Your connection, I think, is gone. And please add in the chat if there's anything I'm missing. So just to take over here, so on case management, what Nigeria are doing, they've reviewed all the existing cases to classify them in low, medium, and high risk. They've come up with about 90 high-risk cases that need immediate follow-up. Because of what you said earlier of access restrictions, lockdown, and also saying that a lot of areas are only accessible by helicopter, for example. It really restricts what they can do. And they've mobilized a lot the community-based network that was already existing and already mobilized. And so the way they're doing it, when the caseworkers cannot access the locations, they have community-based volunteers who go and visit the child. That is done with a briefing with the caseworker before and after the session with the child. So that way it really contains that meeting and gives support and supervision. Then some challenges that they have is, again, poor networks with the phone. So even sometimes reaching the volunteers is a challenge. They've tried to change network for that. Making sure that there's enough credit. That's an issue, I think, for everybody, making sure that in the proposals that's reflected. And then being able also to get COVID protective material supplies to volunteers, especially when there's a lockdown. So they do that, they've done that when it's lifted, when they can. Blasius, anything else you wanted to add here? No, so I think.
Yeah. Thank you, Blasius. Sorry we lost you, and thank you, Leila, for stepping in.
Welcome.
Now we will go directly to Mina, where we will have a shared presentation between Marta from Jordan and Palestine and Hassan from Lebanon. If I may also ask you to be as much concise as possible. Thank you.
Hello. Hi, this is Marta, the program coordinator for Jordan and Palestine. I will be very short. I divided my presentation into, let's say, three sections that will be then complemented by Hassan with a set of tips on how we carried on activities and program development so far. To be starting, what we are successfully doing is case management, of course, on a remote basis. So we have a full lockdown in Jordan since a couple of months. We started with issuing dedicated guidelines on case management, operated on a remote basis, starting from the revision of the caseload, the classification of the caseload, the integration with children that might be not a primary concern in normal times, but there might be an heightened concern, heightened risk during these COVID-19 circumstances. So we are keeping up on following the caseload that was introduced via WhatsApp, among others. We have built up some WhatsApp groups for information sharing upon a consent. That was also collected via WhatsApp, but also by like information sharing over the phone, and with the social media that I will tell you more about after, and also via an app, Native, which is actually conveying best practices, best hygiene practices in a child-friendly manner. The intervention was enforced by early capacity building. We tried to launch some webinar on psychological first aid operated on a remote basis. Two colleagues, both psychologists, prepared the material and facilitated it. The idea was to have a peer-to-peer let's say, capacity building modalities in which caseworkers and but not only, also community-based child protection committees and youth committees and partners were able to share their experiences and their best practice on an evidence-based modality. That was, I think, pretty fruitful, and it's also a way to keep up with a little bit of team building and the mobilization, considering that it can be a little bit alienating to work from home since months without any real contact with the beneficiaries, but also with the colleagues, with the supervisors and so on. We are very much expanding our adjusting our intervention in terms of access to justice. Many children were released via early release sentence or on a bailout because of the willingness of the DRC's directors to empty up the TRCs themselves, ensuring convenient, appropriate health practices to be implemented. Unfortunately, that happened during a complete lockdown, so the Ministry of Social Development couldn't actually reach out for the children that were just reunified or reintegrated into the families and communities with no follow-up. So this is when we stepped in with a lot of advocacy. And we managed to have the Ministry of Social Development referring to us those children. So we started child protection case management process with them on a remote basis. And now we are topping up the action with cash for protection. We are just trying to understand how to develop modalities for cash assistance, considering that they were not part of our cash assistance workload, caseload. So it's a matter to screen now what's the best modality, e-wallet, on-end, or something like that. But the good part is that we were already having framework agreements with service providers. So we're gonna be able to speed up the process anytime soon. In terms of advocacy to force alternative to detention, this is also a part of the work that has occupied a lot of the past months. The idea is that we want to avoid children that were released on a bailout or via early release to go back to the TRCs. That would be very much that would generate a high level of stress in the children, and also a disruption of family reunification that already happened. So this is what we're trying to do, a little bit of lobbying and advocacy, and we are now developing a couple of pagers to build up the case and enforce it with the duty bearers and the donors to attract some attention on those points. We have done since a month and a half now a pretty comprehensive protection monitors and rapid need assessments using qualitative and quantitative different methodologies from the phone, reaching out our former beneficiaries and with weekly reports monitoring the evolution of the conditions of the family, for example, that we have been reaching anyway for case management. That was also we actually decided to compile different methodologies also because the beneficiaries, they're raising a lot of doubts about the fact that they have been reached by a lot of phone calls by different organizations. Some of them, they're starting to be a little bit of annoyed of that level of questioning. So we took it into consideration and we diversified our source of data collection. At the same time, we have been working with social media to promote, at least on a weekly basis, art-based and recreational activities. We set up weekly contest, set up a weekly contest with a team every week that we can vote using the Facebook pages, and then we revert toward the beneficiaries in order to announce who is the winner. And sometimes we take advantage of that higher level of contact with the beneficiary which is winning to build up some an interview that then is further shared with the HQ and also on our own page to share up from the very children voice, what does it mean for them to be in a lockdown and not to be able to go to school. What you're yeah?
Marta, I'm just sorry to interrupt you. It's really interesting what you are saying, but we are running out of time. And I would like also to leave some space to Hassan and to India. So if you may be just closing it with one sentence.
Thanks everybody. I don't know.
Okay, no, if you have just something.
Sorry. Sure, I'm happy to end over anyway. There's many common feature of everybody experience, as I can see. So I guess that that's the moment of Hassan to close the MENA region point.
Thank you, Marta. And anyone who wants to pursue on some of your topics can also get in touch with you directly. Thank you.
Of course.
And sorry for interrupting.
Thank you, Marta. So please, next slide in order to continue. Hello, everyone. Okay, so since I have only 3 minutes, I will see how much I can perform under pressure. Basically, in Lebanon, I'm going to present the mental health and psychosocial support and the GBV case management. For the mental health and psychosocial support, we have shifted from Focus PSS to MHPSS due to the coronavirus effect. For the GBV case management, we have two kinds of interventions. For the low and medium risk, we are following up through the phone. As for the high risk, we are going to the field, doing face-to-face intervention with some of the precautions that we have to do in order not to spread or catch the virus. Also, we are doing awareness sessions based on the needs. For the challenges and highlights and good practices, they mention all the intervention or the remote services that we are offering. So one of the challenges is non-verbal communication, because we are not able to really communicate in the most effective way with people. Sometimes siblings are together in one phone call, one phone session. So basically, sometimes it's not being that much effective, and there's no space for each person to express themselves. Internet connection, it's always a problem, it's always a challenge, and sometimes you are not able to communicate in a good way. Privacy is not always guaranteed. I can't make sure that the child or the person is alone and he is privately speaking and expressing himself. Remote assistance can be sometimes overwhelming due to so many reasons. As for the highlights and good practices, all field staff were trained on PFA, which is the psychological first aid. Staff care, it's one of the basic and most important things. Internal technical support. In Lebanon, we have the technical unit. So basically, the technical staff in this unit, they support the field staff in order to maintain better quality of the sessions. Individual sessions, as we shifted to remote services, we had to do individual sessions rather than group sessions because it's more practical, which gave more space for the person to express himself. Innovation, because it's also something we have to do. We have to use videos, maybe pictures, interactive activities in order to make it more effective. Planning and coordination, internal within the organization and external within other INGOs and maybe donors and partners and so on. Next slide, please. So the mitigation measures and tips, and this also includes not only Lebanon, but for the whole MENA, provide staff with enough resources. We always have to make sure that we have enough internet data, we have recharge cards or enough credits. Clarity of what services are provided by third zone. So basically we have to make sure that we are giving the message for the beneficiary. We are giving mental health and psychosocial support, but we are not giving food items, for example, and so on. We also have to think about plan B in case there's no internet connection, and this is something that is common in Lebanon. What shall I do? Should I do a regular phone call or what? Prepare well before I call. Make sure that there's a good connection. I have enough credits, battery of the phone is charged, and so on. And I have a private place. Keep up to date because sometimes there's a lot of questions and there's a lot of new information coming on a daily basis. We have to keep up to date in order to do that. Coordination with other sectors or NGOs. Understand what the beneficiaries are expecting and what the community, their needs and what their expectations from us as well. Technical support and new modalities. We have to be open and flexible. We have to know that everything somehow is changing, so we cannot just think we used to do this and that way and not accept this modification. We have to take breaks between sessions or calls, especially that remote service can be really tiring. Coordinating with donors, especially when we are shifting our interventions, because we have to take into consideration what this can affect my project, my budget, and so on. Lastly, and I think one of the most important things is that take care of yourself, because the more you take care of yourself, the more you do like self-care, the more you are in a good mental state and in the better mood and so on, the better you will perform and the better you will benefit the communities you are working with. Thank you. I'm sorry for talking so much fast, but this is me under pressure.
Thank you, and sorry to put you under pressure, but thank you very much, Martha and Hassan, for your presentation. It's really, I think it's really important to understand what you are doing in the field and the way you are mitigating some of the challenges. So let's now go to India. Paulami, if you want to take the floor.
Yeah, thank you, Ruth. So I'll just quickly go through some of the points. Can we go to the next? Yeah. So basically, in the beginning, when the full lockdown stage started, in India delegation, we strategically thought of joining different interagency groups, international groups and national level organizations. Firstly, for reviewing different government guidelines and also to identify issues for advocacy for the rights of the children, because generally in this pandemic, when it started, we could see a lot of focus on public health focus, but we tried to highlight different child protection concerns. And as for that, as a member of joining forces, we also submitted an appeal to Prime Minister of India, highlighting the well-being issues of the most vulnerable children is not compromised with the key intervention that would be essential for the most vulnerable and at-risk children. And also we tried to gather informations on different schemes and relief government is introducing, and we were sharing this back to the partner organizations so that the staff has shared this information to the communities and supported the communities, because there was immediate support required for the families in the community. So whenever we started interacting with the families, there was a need to support immediate needs. So that actually helped us to build that trust in the community, that we started providing support and enlisting their name in the government relief support which government was declaring. Then second, also we conducted rapid assessment with the partner organization to assess the challenges faced by the communities to access the services. And also we tried to map the unserved and underserved vulnerable population who are unable to receive relief support from the government, like for public distribution. So if somebody does not have ration card, they were not able to get the ration provided by the government. So based on that, we started negotiating with different government departments. And also we try to understand the challenges they are facing and also anticipated challenges, because right now we know when we conducted this assessment, there are a lot of migrant families stuck in different states, and they will definitely gradually come back. So when the members will come back in the community, what kind of challenges the community foresee. So we wanted to understand that through this assessment. And then we also provided training frontline staff. They made a database of children and young people, and who they are in touch with those children who have mobile, or maybe the family members who have mobile phone. So they are always weekly over telephone, twice or thrice a week. Staff kind of call them up and inquire them how they are feeling, how they are coping with the lockdown situation, how they are spending time, their plans, and also they are inquiring about the family members, whether there is any problem with the family members or discord or violence in the family. Also, they are asking about the food situation, because they are in the beginning there's a lot of anxiety because people were hoarding food, so the food were not available in the market. So always they ask the food security part of it, because we see there's a lot of anxiety around that. We provided support to the partners to join different webinars organized by UNICEF and other international agencies. And then followed up by, after that, we also had discussions with the staff, because most of the webinars so far conducted in English, but the frontline staff, they find sometimes it's difficult to follow. So we try to, answer the questions they have, or try to kind of make it more simple and giving examples to make them understand the information shared through these webinars. And we have a plan to make organize webinars for the frontline staff who are actually working in the field and who are in touch with the community. Field workers who are providing first-hand psychological support to the children and families over phone. But in case of severe distress, children are referred to the trained counselors. So on this project, we have actually have a pool of counselors. So these counselors are supervising frontline staff who are in regular touch, and based on the case, they are referring them to the trained counselors. Counselors are also conducting mock drill to support field workers to handle communication empathetically. And depending on the extent of stress, risk level, children are supported to contact the helpline number announced by government departments. So in India, Childline, which is one national helpline, which has been declared as an essential services. So some of our partner organizations are also Childline nodal agency. So they do have the permission from government to respond severe cases. And this makes them feel more supported and safer, like when they are visited by the organization staff for when they are at high risk, it makes them feel more supported and safer. And if there are very critical cases, we are referring that back to the state helpline, and we continuously follow up on that. Can we also, we are providing continued support to for providing data recharge and phone recharge to the children and young people whom we are in touch with. So as I remember, Childline have been declared as essential services, and some of the government has given permissions to some of our partner organizations. So it's easier for us to respond individually, maintaining all social distancing, to respond individual high-risk cases. And also we are in providing different e-books, movie links, educational links through WhatsApp groups. And we have provided art kit and indoor play materials to the children and young people, so that they are locked inside homes, and they can use these materials when they are staying at home. So this has been given to everyone. Depending on the case basis and family situation, we are putting credit, and we are giving them some kind of technology support, like how to use WhatsApp, how to join group communication. But in WhatsApp, the problem is it's only 4 members can have we are looking at giving them training to join like Zoom and other Skype, other kind of discussions, but that will take some bit of time because everyone is not that tech savvy, and especially it's in a different language, so it's difficult for them to follow it. So probably we need to think of something. For safeguarding and ethical consideration, all our partners have their individual child safeguarding policy. And in India, we have this Juvenile Justice Act, where these children who are in crisis falls under the category of children in need of care and protection. And as per this Juvenile Justice Act talks about maintaining confidentiality of the cases and also our safeguarding. So every time we organize fortnightly discussion with our partners, and we consciously add one agenda on data protection safeguarding, so that wherever they are stuck, they are coming with some questions and how to protect data, how much information they should be sharing, how much they should not. So we try to answer those questions, and because they have their individual safeguarding policy, which already emphasize the importance of confidentiality. And counselors are also being trained on, because they have been trained on advanced counseling, so they are aware of how to maintain this confidentiality. So when they conduct the mock drill with the field level staff, they always emphasize that how to take the consent and understanding the situation that the particular children are in. Can we go to the next slide, please? Yeah. So some of the challenges are like many of the staffs who are working at the front line, they are not able to access, they don't have smartphone or high quality internet, or sometimes they don't know how to use these platforms. So some of the partners and the staff, especially at the frontline level, animators, so they are finding it difficult. Children who are experiencing violence at home, they find it difficult to share their concern over phone. So as Maria was mentioning about, taking some cue when they are stop, or when they are the tone of their voice change. So the staff try to pick it up from that kind of, but it's very difficult for them to share this information privately. A vast majority of them, the children and families, they don't have the smartphone. So we are trying to get the information of the children who doesn't have smartphone from the volunteers and peers, but still it's very difficult to, contact them regularly. And we are very kind of, this also creates a divide among the children having the phone and not having the phone. So we really need to think about how we can do that. We, as we mentioned before, there are some of the presentation smartphone mobiles are running out of the cache. So how to provide them with regular credit and recharge. There are very less materials available in local languages. So most of the guidelines, IC materials which we find, is mostly in English. So there is a need of translating or making IC materials in the local languages, which they can able to read and understand. There's a lot of fake news are they are receiving through WhatsApp, through their Facebook account. So sometimes it's they are getting confused, and with the wrong informations, our staffs are trying to clarify, but definitely the wrong information, it's a big challenge for them. But also bonding, because the group activities we are not able to do so far. So bonding and collaborative communication among the peers, it's difficult to continue. This is a big challenge because they are not able to have that collaborative communication. For children who, also when we did the assessment, we found that the community level child protection structures, which is like the formal and informal structures, have become non-functional due to the lockdown situation. So, so this is a challenge because it becomes very difficult to get these duty bearers on board when we are responding cases and trying to develop a support mechanism in this situation. So thank you. That's it from my side.
Thank you very much, Paula-Mi, for this. So we understand that we are still facing a lot of challenges. In fact, we had planned to have a time of question and answers, maybe to discuss about those challenges, but because we are a little bit late on time, we will need to just to go to an end shortly. So Maria, I give you just the floor.
Yes, we just wanted to, first of all, again, thanks very deeply the different presenters that we had and to convey and to share with us their experience, the highlights, their good practices and challenges. I think what was very interesting was to see that actually there are some very specific ones, but that also there are some very common ones. That doesn't mean that the same response is needed, and that of course always there needs to be adjustment according to the context and the type of services we are delivering. Just in line very quickly with some of the questions regarding you know, the possibility to have access, of course, to the presentation. This will be done to this this webinar has been recorded, and there was some specific request about having institutional guidance or documents, so things that can be also useful maybe to convey the message to the teams or to organize capacity building. And so just to tell you that following this webinar, there will be, so the webinar recording will be available, the PowerPoint will be available. We are planning to actually develop some info sheets that will be really short documents that gives you hints about some of the key information that we have shared today. Probably one around data protection and the issues about protocol, safeguarding protocol, and another one on the specifics of soft skills. And so also we will be developing a short Q&A response document. That means we'll come back on all the questions that has been asked during the webinar and formulate an answer. Unfortunately, yes, there was some very interesting also discussion about the fatigue of some of the people we work with regarding assessments and so on, and what would be some innovative ways to actually avoid this fatigue. So all this we'll try to capture it in a Q&A document that we will share with you. We can see here on the screen the link to the SharePoint. That is where there is a specific COVID-19 page. And following this link, this is where we will put the documents we just mentioned. If there are further questions, of course, you can also contact us, the different focal points for your delegation, where we can try to answer more specifically in bilateral. Before we leave, and we see that most of you already are on the way, and we understand because we are quite late, we had prepared a few polls in order to guide us a little bit on what would be the next steps as a community of practice around this the challenging situation in responding in this COVID-19 context. So maybe would be great if you can just stay another few minutes with us to answer the few polls we have prepared. So the first poll, I think it's going to be launched now, is looking at, I mean, speaking about remote services, we would be interested to know if there are some specific topics where you would like additional discussion or exchanges. It could be specifically on soft skills, remote communication. It could be case management, doing remote case management and looking at specific challenges that you'd like to discuss more. Could be about the specifics of the IT tools, the technology to be used, on data protection, on remote PFA. As we said, that it's a quick win, I would say, in terms of supporting remote communication, remote counseling, and also remote MHPSS for group settings, which we know is also a challenge. So we just give you a few minutes in order to select. Please only select two of these topics to give us an idea a little bit of what is the main priority for you on the field, and then accordingly we'll see how we can support. Yeah, as Leila is mentioning, if you have other topics that are not mentioned here, you can also mention them in the text box. So I would really encourage all of you to answer to this question, as it will be really helping us to view the most important topics. So I think, okay, we have here the second poll, which is actually asking you, beside the remote services specificities, what are some of the other CP related topics that you'd like to discuss? And so you have here a list where, again, if your priority doesn't appear here, we encourage you to write it in the text box. So you have quite a long list, so take a few minutes just to have a look and tell us a little bit what are the 3 main topics you would select for the next focus of technical support. It's interesting to see it moving online. It's like we'll just leave another couple of minutes. Okay, we just wait another minute to see if some other people want to contribute. So we can go, we've got a last poll after this one looking at the format of support. So we just wait a few minutes. We've got now nearly 2/3 that has been answering this question. Okay, maybe we move to the last poll, which is about the format actually of the support. We have proposed different kind of support. One would be a little bit similar to this one, about a thematic presentation and discussion, which could happen actually at global level, considering the language still. Another one would be to support in regional discussion, willing more to have exchanges within the same region. It can be also about having bilateral discussion on very specific topics, and the topics that you mentioned before. And another option would be to actually trying to have a kind of platform, a team platform, where there potentially possibility to have some discussion, have some questions, and really generating some exchanges. So we'll just take a few minutes for some of you to contribute here. While you are filling up this last poll, I just want once again to thank really everyone that has been involved in preparing this webinar, being the field, having your time on the field to take time to have these discussions. Ruth, also, thank you very much for facilitating the webinar. Leila, Lourdes, Jesus, and Eric. Thank you very much for your contribution. I think the Eric and Jesus had to leave. I hope that we can really follow up with all what has been initiated today. in terms, of course, of exchanges, and we'll capture a little bit the findings of these polls, and we'll know about the next steps. Ah, hi, Eric. I didn't know you were still here.
Thank you, everyone.
Thank you again for everyone, and we'll follow up for sure,
Yes.
on the SharePoint and with your propositions. Thank you.
Thank you.
Great.
Thank
Thank you
you.
very much,
Bye-bye.
everyone. Have a good
Bye.
day.
Bye.
Bye.